You want to do the snaps or you want me to do it?
Oh, you can do this now. Anyway, we were doing a sound check. So we're going to talk about Embiid, 76ers, playoffs, what's happened. Here's the video.
Damn!
He comes in, right leg, lands on it, kind of buckles, and then he falls, slaps right on his butt. Did I say butt? But, turned out he had a meniscus injury. What does that mean? Well, my son would still be laughing at the butt comment, and he'd be going on and on and on and on and on, saying, you said butt, Daddy, you said butt. It would be endless. So if your kids are watching, you'll have a little funny for a little while.
COVID.
I've been vaccinated. Those are allergies. Let's get back to his injury. So it's clear that he landed right on his ischial tuberosity. Boom, that can hurt. So sometimes the initial pain or the more significant pain acutely may be just landing on the hard floor, right on his ischial tuberosity. He grabs that, or could it have been a hamstring strain? He landed, we've talked about this before, muscle impedance, harmonics, frequency of muscle vibration, landing, hard surface, contact load, ground reaction forces, all of those things can cause a little jiggle in the muscles, and they can contract and relax and be tense at the same time, called eccentric muscle contraction. And he could have strained his hamstring, so he grabs there. Or could he have had an actual back strain and had a little, almost like a stinger when the shoulder, people injure their shoulders or neck in football, but you can have something like that where you have an acute radiculopathy. Maybe he didn't, but whatever it is, you see him grab his butt and his back, and he's not sure what's going on. However, you can also have pain from the knee, and you can have overlapping symptoms, and initially higher pain from the initial contusion to his back, his hamstrings, and then he realizes, my knee is sore. So he could have done both, certainly. Could have sprained his knee, could have tweaked his knee. What kind of meniscus tear he has, read it up. Read it up or read up on it?
Probably read up.
If you think you're good at grammar, comment down below and tell me whether read up on it, read it up, or whatever is better. Correct my grammar, please. So, if he has a meniscus tear, what happens? Young guy, athlete, big dude. So what does that mean? That means that he's at risk for putting a lot of force through that knee on that meniscal cartilage. So in the end, knee, inside knee, meniscus, medial, lateral. Do we know whether it's lateral or medial?
I don't know.
They never give enough detail. Don't you think they should give more details on athletes if it's HIPAA compliant? Right. HIPAA. That's important. So, meniscus tear. Cartilage, semilunar, shaped. Bang, boom, crack, snap, twist. Lots of injuries. But if it's repairable, then he needs 6 weeks to recover from a repair. Then he goes into rehab. So will he be coming back quickly? We don't know. If it's a partial meniscal tear that doesn't need repair, or it's a little bit of fraying, then he doesn't need surgery, scope, in and out, boom, he's done. Or if he doesn't have locking and it's minor fraying, doesn't need surgery, then he's back, but it'll take a few weeks. Or, we talked about this before, he's having this done, they'll shoot him up with a bunch of vitamins, vitamin D, vitamin and calcium, and a number of other potential regenerative technologies, try and get him back, and he's back in the game sooner if it's non-surgical. So lots of different options. This does affect the playoffs. What's going to happen? I don't know. Let's find out.
If you were going to bet it would have to be a pretty minor injury and pretty minor meniscal tear for him to be able to come back in this series.
Oh, yeah. Yeah, I agree. Like, so here's the thing. Whenever you deal with professional athletes, college level athletes, you're always dealing with a balance, okay? So you've got the demands by the general manager and the team. You've got the demands by the coach. You've got and the demands and the concerns by the player, right? So there's a lot of different factors. The player doesn't want to lose out and play in the playoffs. This is what he loves, but he also doesn't want to hurt his knee more. Then you got the demands of the team that's like, we need to win this championship. And then you have the coach who's also along the same lines. Then you have the therapist and the trainer. So everyone has sort of conflicting values and interests, but ultimately it's the player's rights, which may actually be governed by the team, which may have oversight by a medical body. But who cares about doctors? They don't know anything anyway.
It's not like you're a chiropractor.
Yeah, I know. Yeah. I actually have some good friends and colleagues that are chiropractors. I think within scope of practice is reasonable. We don't need to go there. We've got plenty of comments from my other review of some chiropractor concerns with spinal manipulation, but we don't need to go there. In this particular case, we're talking about a knee. And with a meniscus tear, if it's minor, doesn't need surgery, could he be back in the game? Player wants to come back, coach, team, they all want him to come back, but player should put his rights first. He wants health on his knee. And if he wants a healthy knee, then ultimately he should get 1, 2, maybe 3 opinions, decide what's best for his knee, and then move forward. If that means giving up being in the playoffs this year and potential championship, that's ultimately the patient's call. There should not be any undue pressure by any team or contract. And it's kind of unfair, but sometimes, athletes are let go because of injuries. Who knows how the contracts work? It's kind of unfair. But that's just the way the NBA rolls. Or any professional team or sports role. Because ultimately that's their job. And you or I, we have maybe some more luxury in making those decisions, but we ultimately have to do what's best for our health. But work, health, life balance, all of those things go all together. I'm not a health and wellness doc, but there's plenty of people out there doing that. Just go take a look. I'm a surgeon, damn it. So, will he come back? We don't know. Let's find out. Because if he has a repair, unlikely back in the playoffs. If he has a minor tear that requires arthroscopy or just a diagnostic arthroscopy or even a minor clean out, even if the MRI suggests a meniscectomy or meniscal repair and it turns out it's minor fraying, then he could come back sooner than that, within a few days or a couple weeks, definitely, as long as the wound is healed. And if it's just non-operative, then it's just a matter of rehab. So ultimately, it'll come back to what the patient decides, what the team decides, what the coach, medical team with the sports medicine doc, the trainer, physical therapist, and the patient making a combined decision-making approach as to return to play. Simple? Not quite.